Have you ever sat across from a client and thought, they just had a breakthrough, so now what? Or maybe you felt that ache in the room, a client who's stuck, who's hurting, who wants something to be different, and you're wondering, what do I actually say or do to help them get there? That's what today's about. It's one thing to listen with empathy, and that really matters. But at some point in the counseling process, clients don't just need a space to talk, they need support to change. And that's where these techniques come in. Change techniques help bridge the gap between talking about it and doing something different, between knowing and acting, between stuckness and movement. But, and this is at the heart of today's lecture, these techniques only work when they're used with care. You can't just plug in a strategy and expect it to work. The client has to be ready. The relationship has to be strong. The timing has to be right. So we're going to slow it down. We're going to learn how to think like a helper who's intentional, responsive, and skilled, not just reactive or scripted. And we're going to use the REPLAN model to guide us, a framework that shows us where clients are stuck and how we might help them move forward. So here's what we're doing today. At the end of this session, you'll be able to name, understand, and practice a range of change techniques, the strategies that help clients move from talking about change to actually doing something different. We're going to break down the REPLAN model so that you have a clear framework for planning interventions. We'll learn how to match techniques to a client's readiness for change using stages of change model. We'll walk through a cheat sheet of techniques all on one slide that you can refer to again and again, and explore tools that will support emotional regulation, motivation, insight, and new behavior. And we're going to practice thinking through how to choose the right tool at the right time for the right client. Because challenge without timing, that can rupture the relationship. But challenge with warmth, clarity, and attunement, that's where change lives. So let's go. So before we jump into the techniques, let's take a step back and ask, what are we even talking about when we say change techniques? In short, these are the interventions that help clients move from insight to action, from being stuck to trying something new, from surviving to growing. They're not just clever tricks or quick fixes. These techniques only work when you use them at the right time, with the right level of client readiness, and within context of a strong therapeutic relationship. So just think about it. You can't reframe somebody's thinking if they don't feel safe with you. You can't assign behavioral homework if they're not even sure they want to change. The real art of helping is knowing when to use a tool and why you're using it. And that's where the REPLAN model comes in. It's a framework that helps us organize our interventions based on the client's needs, not just our preferences. Each letter in REPLAN represents an area where change can happen: relationship, efficacy, practice, lowering or raising emotional arousal, activating hope, and new learning. And you don't have to memorize it right now. We'll walk through each one in this lecture, but think of REPLAN like a treatment planning compass. It helps you orient yourself to the client's process and figure out where to go next. So as we go, ask yourself, what does this client need right now? Which parts of their process feel stuck? And how can I help them move? And that's what change techniques are about. So here's where things start to come together. You've learned about the REPLAN model, 6 areas that we can target to support change. But how do you know which to use and when? That's where the stages of change model can come in. Think of it like this. You wouldn't push somebody to change a behavior they're not even ready to admit is a problem, right? So we pair REPLAN with the stages of change to help guide our interventions. So let's walk through it. The R stands for relationship. Focus here is in pre-contemplation and contemplation. That's where the client might not trust the process or might not even see the issue clearly. Your job is to build safety, show respect, and earn their trust before anything else. The E stands for enhance efficacy or self-esteem, and this fits best in preparation and action. Once clients start to think about change or try new things, they're going to hit some self-doubt, maybe some imposter syndrome. They need to believe that they can change. This is where we support their confidence, interrupt negative self-talk, and highlight strengths. P stands for practice new behaviors. This is most useful in preparation, action, and maintenance. The client is ready. Now we help them do the damn thing. Try it, rehearse it, plan it, follow through. This is where behavior change actually takes shape. L is for lower or raise emotional arousal, and this can show up anytime, but especially when a client is in crisis or stuck in contemplation. If someone's overwhelmed or emotionally shut down, they're not thinking clearly and they're not changing. So we need to help them regulate first. A stands for activate hope and motivation. This is also best for pre-contemplation and contemplation. The client doesn't know if they want to change yet, so you explore what's possible. Ask about their values, their goals, or even just a small sign that change is worth considering. And N stands for new learning. It can be useful in all stages, but especially in contemplation and maintenance. Sometimes insight is the missing piece, a new way to look at something, a new piece of information, a reframe, some psychoeducation. Other times it's going to look like reinforcement, keeping the client aware of why they're doing what they're doing. So don't just throw a technique at a problem. Think about the stage that your client is in, then choose your intervention accordingly. The more aligned your strategy is with their readiness, the more effective it's going to be. Okay, so here's your cheat sheet. These are the main change techniques we're focusing on, organized by the REPLAN model. So think of REPLAN like your treatment planning compass, with each letter representing a factor that supports change, and each factor has its own set of go-to techniques. So looking at relationship, everything rests on this. If the relationship isn't strong, no technique will work. Sometimes the intervention is the relationship, affirming the alliance, showing transparency, or repairing a rupture when trust has been shaken. Moving on to efficacy and self-esteem. These techniques help clients rebuild belief in themselves, countering distorted self-talk, using affirmations, and highlighting their own strengths. These are all ways to boost their inner sense of, I can do this. P, about practicing new behaviors. Change doesn't stick without action. Think role plays, behavior experiments, or homework that nudges the client to try something different between sessions. And when we're looking at lowering or raising emotional arousal, some clients need to calm down and regulate, others need to feel what they've been avoiding. Tools like breathwork, expressive art, or even just helping somebody name their emotions can shift things. And the A for activating hope and motivation, this is where motivational interviewing can really come in, using things like scaling questions or the miracle question to help clients imagine change and move towards it. And then finally, N is about new learning. Sometimes change comes from insight, a new way of looking at something, using reframing, psychoeducation, or metaphors to help the client see things from a different angle. So you're not expected to memorize all this today, but the structure gives you a place to start thinking critically about why you're using a technique and what your client might actually need in the moment. And let's shift for a minute from thinking to sensing. When we talk about change, we often focus on what clients think or say, but a lot of what drives behavior lives in the body. Interoception is your internal sense of what's happening inside of you. Your heartbeat, your breath, your stomach clenching, your chest tightening, your skin prickling. It's the body's way of saying something's happening. And for many clients, especially those with trauma, addiction, anxiety, or neurodivergence, this connection can be dulled, confusing, or completely shut off. So why does this matter in counseling? Because when clients don't notice what they're feeling, it's hard to regulate emotions, interrupt automatic reactions, and even name needs. Interoception work helps clients recognize the early signs of emotional dysregulation, build self-awareness from the inside out, and make more informed, grounded choices. And with awareness comes choice, and with choice comes change. So how do we support all of this in session? Let's look at a few techniques from the Interoception toolkit that you can either use or teach to clients. Starting with body check-ins. So you're going to ask, what are you noticing in your body right now? Or where do you feel that emotion showing up physically? Even a pause to scan head to toe can help clients connect thoughts and feelings to sensations. We can also try the pause and notice breath. Invite clients to take a slow breath in and out and ask, did anything shift in your body just now? This builds awareness that their body responds to their attention, which can be empowering. We also want to look at movement or art as interoceptive practice. Sometimes talking is too hard. Invite the client to draw how their anxiety feels in their body, use stretching, walking, or guided movement to reconnect. The point isn't to analyze, it's to experience and notice. And as a counselor, you don't have to be an expert in somatics, but you do need to understand that the body is part of the conversation, and that for some clients, it's part of what's been missing for a long time. Helping them tune into what their body is saying can be a powerful change technique, not flashy, not fast, but deeply healing. All right, so let's step out of our heads and into our bodies and try this all out for ourselves. You're going to try some short experiential practices designed to help you connect with your own interoceptive awareness. That is, your ability to notice what's happening inside of you. This isn't about doing it perfectly. It's not about fixing anything. It's just about noticing and seeing what happens when you pay attention to your body on purpose. If you're able, find a quiet spot where you won't be interrupted. You can try to close your eyes if you're not driving. Sit comfortably and get yourself into a zone here. We're going to start with a 60-second body scan. Starting from head to toe, slowly bring your attention to the top of your head, your face, your jaw, your neck. You roll your head around a little bit to get in touch with your neck muscles. Your shoulders, you might try to raise and lower them just to see if you're holding on to anything. And move down to your arms, your chest, your stomach, your hips, your sits bones, upper legs, your knees, your calves, and your feet. And we wiggle your toes. As you scan, notice any places that feel tense, warm, cold, heavy, or light. No need to change anything. Just notice what's there. I'm going to stop talking for a second here so that you can move through that again without having to listen to me. You can go again from the top of your head down to your toes, or maybe go in reverse, toes back up to head. Just notice what you're feeling. And in this, you want to notice, is your breath fast or slow, deep or shallow? Where do you feel it most? In your chest, your ribs, your belly? Just stay with that for a moment longer. Again, we're not changing anything. The goal here isn't relaxation, but can be a good outcome. We're just paying attention. Once we've done the body scan, we can move on to some intentional breathing. So bring your attention gently to your breath. Take one slow, full breath in and exhale. And again, breathe in, breathe out. Do that 2 more times at your own pace. And as you do, just notice, did anything shift? Did a muscle let go? Did your thoughts slow down? Do you feel anything new or feel less of something? And after focusing on our breath, I like to pay attention to some expressive awareness because I'm an art therapist and I just feel like there's always going to be a place for art. So if you have a piece of paper nearby, take a moment to draw or write out what you noticed. Doesn't have to be artistic. Just think of it as a snapshot of your internal experience. Maybe it's a swirl where you feel tension. Maybe it's a word that captures your breath. Maybe it's the color that represents your overall feeling right now. And after you've created a doodle, a drawing, a painting, whatever it is, I want you to pause and reflect on this experience. You can write in a journal or just think about these questions. What did you notice that surprised you? Was there any part of the scan or breath that felt uncomfortable, unclear, or grounding? How might this kind of practice help a client who struggles to name their emotions? How does this connect to introspection and the work of counseling for change? When you're ready, you can return to the lecture, take your time. If you want more time, just pause here. I'll be around when you press play again. And I really want you to thank yourself for giving yourself this moment. Okay, getting back into the swing of things with the lecture, we're just going to start talking about some motivational interviewing tools. And motivational interviewing, also known as MI, is one of the most practical and widely used approaches to supporting change, especially when a client is ambivalent or unsure. We hear a lot about this in addictions treatment, but I just want you to know this is available to you through mental health treatment too. You don't have to be working in addictions to use motivational interviewing. Ultimately, MI is a client-centered, directive method for enhancing motivation to change by exploring and resolving ambivalence. And that's a fancy way of just saying it helps people move forward without being pushed. And it's a great match with the REPLAN model, especially when you're focusing on activating hope and motivation. That's the A in REPLAN, strengthening self-efficacy, the E, and sometimes even the relationship, or the R. And at the heart of motivational interviewing lies 4 core micro skills known as OARS. O stands for open-ended questions, so we're inviting exploration. Instead of, did you go to group this week? Try, what was it like getting to group this week? A is for affirmations, highlighting the strengths, efforts, and the values. You might say, it took a lot of courage to come in today, especially after the week that you've had. R is for reflections. Be that mirror back to what the client says to deepen understanding and build connection. Something like, you're not sure you want to change, but you're also tired of how things are. And then S stands for summaries. Gather key points and offer them back. This helps organize the client's experience and shows that you're tracking. And another big concept in MI is the difference between change talk and sustain talk. Change talk is anything that leans towards growth. I want things to be different. Maybe I could cut back. I'm tired of feeling this way. Sustain talk is holding on to the current pattern. It's not that bad. I've always done it this way. I'm not sure I can change. Our job isn't to argue with sustain talk. It's to evoke more change talk. That's why MI encourages counselors to roll with resistance instead of confronting head on. When the client's not ready, we reflect it with curiosity. We help them hear their own ambivalence. So where does this fit with REPLAN? OARS supports relationship building and enhances efficacy. That's the R and the E. Change talk evokes motivation. That's the A. Rolling with resistance helps regulate emotional arousal, or L. And summaries or reflections often provide a way of understanding, and that's the N. So the bottom line here is that MI isn't a separate technique. It's a style that makes everything else more effective. If REPLAN tells you what to do, MI will help guide you how to do it. Before we wrap up our techniques, let's talk about something that doesn't always get listed on a treatment plan. You. The research, the models, the techniques, the interventions, they matter. But when you ask clients what actually helped them change, most of the time they don't say, "My therapist reframed my negative cognition." They say something like, "I felt understood. I could tell she really cared. They saw something in me that I didn't see in myself." And this is what Kottler describes in On Being a Therapist, that our way of being is the intervention. He wrote, "Although we are trained to believe that this is our knowledge, skill, and experience that produces change, it's often our presence, the strength of our being, that's most healing. Clients change when they feel seen, believed in, and held with care. Your presence, your attunement, warmth, and authenticity creates the conditions for change." So the question becomes, how do I show up when I'm really attuned? How do I listen, not just to what the client's saying, but how they're showing up? How do I track not only their defenses or patterns, but also their bravery, their effort, their longing? When you're grounded, curious, and truly with them, that is a change technique. Especially when the client's overwhelmed, ambivalent, or unsure of their worth, your presence communicates, "You matter, I'm here, I'm not giving up, and I believe in your capacity to grow." Don't underestimate the power of that. And even though this lecture focuses on individual counseling, there's a lot that we can learn from the world of group therapy, especially from the work of Irvin Yalom. Yalom identified core therapeutic factors, common elements that show up again and again in effective groups. Here's the thing, these factors don't just apply to group work, they also show up in individual counseling too, if we're paying attention. One of those is the installation of hope, the sense that things can get better. This is a powerful motivator. When in a group or one-on-one, your belief in the client's potential matters. This connects directly to activating hope in the REPLAN model. Another is interpersonal learning, the kind of growth that comes from being in relationship with another person. In group, this might come from peer feedback. In individual work, it's a little more subtle. It's how the client experiences you. Do they feel heard, challenged, understood? That's our relationship and end for new learning at work. And then finally, catharsis, the release of pent-up emotion. In group, this might happen when somebody finally tells their story. In individual counseling, it might be a tearful moment of truth or a burst of anger or even laughter. These emotional releases support L for lowering emotional arousal and help clients feel their way towards insight. So even if you don't plan to run groups, it's worth remembering. The same forces that help people grow in group therapy are often already happening in your one-on-one sessions. You're just holding that space more quietly, more intimately, but just as powerfully. All right, so now you've got a toolkit full of interventions and a framework to organize them using REPLAN. But knowing the techniques isn't the hard part. The challenge is knowing which one to use and when. And this is where clinical judgment really starts to develop. And it starts by asking good questions. Imagine this like a decision tree, not to give you a right answer, but to help guide your thinking. 1. What stage of change is the client in? If they're in pre-contemplation or contemplation, they might need motivation, relationship building, or new perspectives, not action plans. 2. Are they stuck in thought or behavior? If they can talk about change but can't do it, focus on practice and behavioral tools. If they're going in circles mentally, try insight, emotional regulation, or reframing. Are they dysregulated, disconnected, or discouraged? If they're overwhelmed, slow down. Focus on lowering arousal, offering safety, or reestablishing connection. And then 4 is what's worked before and what hasn't. Always consider the client's history with interventions. What felt supported, what felt forced. This helps to build trust that reduces the risk of rupture. And once you've asked these questions, you need to match it to the REPLAN area. If they need safety or trust, focus on R for relationship. If they're ready but unsure, try E for efficacy or A for activate hope. If they need to try something new, use P for practice. If they're overwhelmed, start with emotional arousal. If they're searching for clarity, offer some new learning. It's not about memorizing scripts, it's about reading the room, reading the client, and choosing the tool that fits their moment, not yours. So let's pull this all together, not just by thinking, but by practicing. Because knowing a bunch of techniques is one thing, learning how to choose them, use them, and trust yourself to adapt in the moment, that's where the work is. So let's walk through a couple quick examples. So imagine this first client, Jamie, 27, comes to session saying, "I know I should leave this job. It's toxic, but I don't even know where to start. Every time I think about updating my resume, I just shut down." They seem anxious and defeated, but they keep showing up to counseling. So you're going to want to ask yourself, what stage of change are they in? Sounds like maybe contemplation to me. And what do they need right now? Insight, encouragement, a plan? And so which REPLAN factors are standing out to you? Pause here if you need a couple more minutes to think. A lot of people would jump to problem solving here. You might actually start with motivation, emotional regulation, or self efficacy, depending on how Jamie presents. Here's our second client. Carlos, 42, is in recovery and has been sober for 6 months. He's proud of his progress, but says, I don't know who I am anymore. Everything in my life used to revolve around drinking. I don't know what to do with myself now. What stands out? It's not about behavior anymore. It's about identity, purpose, and insight. You might focus on new learning, activating hope, or relationship, depending on how connected Carlos feels. And I want you to pause and reflect. Which replan factors do you feel most drawn to in your work? Which techniques feel natural to you? Which feel awkward or hard to imagine using? What might tell you about your own presence and style as a counselor? It's okay to have favorites. It's okay to feel unsure. This is part of your development around exploring your clinical voice, the techniques that fit you in the moments when you might stretch and try something new. So let's bring it full circle. You've learned a lot of techniques today, tools for building insight, encouraging behavior change, regulating emotion, and reinforcing client strengths. But the truth is that techniques are just tools. They're not magic. They don't work on their own. What matters is how and when you use them and the relationship that you've built with the client. The real power of change techniques comes from your timing, your attunement, your ability to sense when a client is ready to move and when they need to pause. Don't rush insight. Don't force action. Just stay with the client. Support their readiness and trust the process even when it's slow. And remember, you're going to feel better at this with practice. You'll try things that'll fall flat. That's just part of practice. And you'll have sessions that surprise you. Keep showing up, keep reflecting, keep adjusting, because that's what good counselors do.